Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. We are talking about the thyroid, and here to tell us more is Express Care's Dr. Jitka Lom. Let's go to now our viewer questions. Are thyroid problems more common in women? If so, why? You did kind of touch on this earlier.
They are more common. It's about 10 times as common as in men. The reasons why, nobody really knows. One hypothesis is that women are more prone to autoimmune diseases of all kinds, and so this often is an autoimmune disease where your own body is attacking itself. That's one possibility, but it's just something that women are more prone to.
Okay. Are thyroid problems genetic?
They can run in families, especially things like Graves' disease, that's the hyperthyroidism, and even the hypo, which is the one common one is Hashimoto's thyroiditis. Yes, they do run in families.
Okay. Should my eating habits change now that I've been diagnosed with thyroid disease?
Well, it depends a little bit on which one of the diseases you've been diagnosed with. For hypothyroidism, you're going to really have to watch your calorie intake because you will have a much slower metabolism. It'll be harder for you to lose weight, easy to gain weight. So watching your calories. For the hyperthyroidism, people eat and eat and eat, and they still lose weight, and that's a whole problem in itself. But usually what happens in the hyperthyroidism, or if somebody has thyroid cancer, after the thyroid is removed, they end up with radioactive iodine. And the reason for that is because the iodine is taken up by the thyroid gland. Actually, the thyroid hormone that it makes is made up of 3 or 4 iodine molecules that are stuck together. That's what thyroid hormones are. And so when you take radioactive iodine, it goes in there, it's taken up by the thyroid, and it destroys the gland. So in preparation for that, you want to have a gland that's really, really low on iodine. So people go on an iodine-free diet for 2 or 3 weeks or maybe a month before they have their radioactive iodine. And that's a really tough diet because you can't eat any dairy, you can't eat any seafood, no bread, no pasta, and no salt. So it's basically green vegetables.
Wow, I don't know if I can do that for that long.
It's pretty hard.
All right. The next question is, are there any home remedies let's get to the other question first, is how can I deal with my weight issues? I exercise and diet and still can't lose weight, so that must be hypothyroidism. Yeah, it's very difficult. You have to optimize your thyroid medication, okay? Because if you take the appropriate amount of thyroid hormone, you can even supplement it if you're sort of we call it subclinical, meaning you're just a little low on the thyroid. You can take a little bit of a supplement to help boost your metabolism and so on. But it is very tricky, and so you have to be quite diligent and count your calories and make sure you exercise and really watch what you're eating. Even then, it's a challenge, so just do your best. Okay, and our last question is, are there any home remedies for thyroid issues instead of medication?
Not that I'm aware of. This is one where the specialist that deals with thyroid problems is called an endocrinologist, and in conjunction with surgeon. And this is one where you really do need that expert advice. It's not something that you should leave or ignore, because it can affect, again, the metabolism of your entire body. There's really no system that isn't affected by thyroid.
And you were mentioning that the only way that you would ever know I guess if your family had thyroid issues, then you would know, okay,
you might know. If you see a lump, you might know, but otherwise you really might not know until you start having some of those symptoms. So it's easy to check it on an annual health exam. Include it if you have overweight issues, or if you've been losing weight, or if you have any other symptoms that we mentioned of general fatigue. It's easy to check that with your blood test.
Okay, any last parting words that you'd like to leave with our viewers on the issue of thyroid problems?
Well, I think it's just really important to screen for it, especially in elderly people, because depression and high blood pressure and high cholesterol, these are things that I pick up all the time as a result of a thyroid problem, And so if we just, those 3 complaints, high blood pressure, thyroid problem, or depression, and fatigue, of course, easy to check it with a blood test to see if that's your problem.
Okay, sounds good. Thanks so much for your
You're
time,
welcome.
Doc. We really appreciate it. Stay tuned. We'll close out the show right after this.